Hello, Dr. Dennis here. We get lots of calls and emails asking us how to properly clean our tables. Well, I can tell you it is something that you want to pay close attention to because it will affect the longevity of your table depending on what you use to clean it. What I would like to start off with is a warning that I will go through all this video, which will tell you do not use any product on your vinyl that contains oil. Okay? Oil is a petroleum product, and so is the Nugahide that's on your tables. And so using it will act like a solvent. And essentially what will happen is that your vinyl will slowly get gummy, and then it will crack and it will break open. You will also find that the place that wears out most commonly and quickly on your table is going to be up here in the thoracic section, right at the angle. And the reason is because that is right where the axillary region of your patients are. And normally speaking, with people wearing even just regular shirts, but particularly tank tops and open top shirts, their skin is going to come directly into contact with the table here. And so what's going to happen is they're going to transfer body oil, they're going to transfer sunscreen and all lotions and whatever they've got on there as moisturizer. And that's all going to get into this area of your table. Hence why you always see on chiropractic tables that it seems like it's in this area that they fail first. Okay, so if you're going to clean your table or only spot clean your table in between patients, the places you're really going to want to get are obviously going to be the headpiece where the face is at, because they're transferring oil up here, and then this axillary region on your thoracic part of the table. Now, I've got a bunch of cleaning products here because everybody likes to get fancy with their cleaning and they want to know what to use. Well, our recommendation is that you use a 2% common household bleach to water solution. So you just take 98% water and 2% regular old non-concentrated bleach, the regular old kind of bleach, put it inside of a spray bottle, and that's what you should spritz your table with and wipe it off with a paper towel or whatever you use. You would do that for daily cleaning and cleaning between patients, and it works very well for keeping the table clean, removing small marks on the table, and definitely for removing that oil. Okay, so it also meets all the disinfection requirements that you basically have, although since COVID, a lot of them did go to a 10% bleach to water solution. I will tell you, if you go to 10% bleach to water, you really need to spritz the table with water after going ahead and cleaning it, because there's the possibility at 10% that you're going to leave too much residual bleach on the table and you'll risk damaging your patient's clothes or staining them, okay? So anyways, our recommendation, 2% common household bleach to water. A bottle like this will last you a year no matter how busy you are, and it's pennies to the dollar and very inexpensive and works really well, okay? Lots of folks like to use commercial products. We don't endorse any of them, but they are available. They come in wipes and they're very convenient to use between patients. Once again, what we're going to tell you is try to avoid products that have any kind of oil in them, because the oil is going to break your table down. Now, this is a good example of a very good product, but has maybe some hidden oil in it. So if you look at the ingredients, it doesn't say oil, but it does say that there's 99.632% other ingredients. And then the top over here says crisp lemon. And if you guys know back from school, usually what happens is that oils come from obviously vegetable sources, and citrus oils are very common for using for scenting and also for disinfecting. So this says it has a crisp lemon scent. So I would look suspect at this one that it might have some lemon oil in it. So this would probably not be the best choice, but the same product that does not have the lemon scent would probably be perfectly good, okay? So you just want to make sure there's no oil or hidden oil inside of it. Now, we might want to also talk about Nugahide. So those are the folks that, obviously Uniroyal Corporation makes the vinyl that goes on the tables, very high quality. What do they recommend? Well, for cleaning the tables in between patients, for cleaning tables on a daily basis, just Nugahide in general, they recommend just using a dilute solution of common dishwashing solution or dishwashing soap and water. And you just spritz this on the table and wipe it off. Now, I don't recommend this, and I'll tell you why, at least for daily use, because we have to, as chiropractors, make sure that our tables are disinfected. And this will not always provide enough assurance that you're disinfecting the table. That's why I suggest going with some type of bleach product, okay? But you can use this for cleaning. Nugahide themselves recommends for body fluids or any really serious staining or anything on the table. They actually recommend a 10% bleach solution and put it on the table and let it sit for at least 5 minutes and then wipe it off, okay? And then you notice this one doesn't look like it should even be here, okay? I have a can of WD-40, okay? So remember what I said earlier, that this is a, petroleum product. It's vinyl, okay? And I told you don't use solvents on it, okay? Because they break them down and make them gummy. But, inadvertently, someone's gonna come into your office and they're gonna have an ink pen in their pocket, or they're gonna have a crayon or something that you go ahead and they get it on your table and you have already used your bleach product and everything else and you cannot get it off, okay? So what do? We recommend getting like WD-40, which is actually a solvent, okay? You just spray some onto a cloth, okay? That's where you start, and then you just wipe it on there very nicely. If it starts coming off, then get a clean area of the cloth, put a little bit more on, and get it off just like that, very fast, okay? If it's really stubborn, it's kind of sitting there and got down in there, put a little bit on there and let it sit for a few minutes and then come back. It'll have a chance to kind of work its way through there chemically, and you can lift it off. If you get to a stain like ink, within like 30 minutes or so, and definitely within 10 minutes of it getting on the table, you will have great success with using something like WD-40 as a solvent to get it off. If you wait a day or two before you try to clean it off, it's going to set and dry and harden, and you're going to have a lot of trouble, and your overall outcome is going to be mixed as far as getting it off the table. And I am also kind of demonstrating that right now on an Adobe white table. And I'm going to close this with another one of the questions I get asked all the time. Is it harder to keep a white table clean than any other? And basically, the cleaning process is the same, okay? But obviously, anything that's not white is going to show up on a white table. So it obviously, in a regular practice environment, is going to show more dirt than, say, a black table, okay? It's not that it's going to be impossible to clean, it's just you're going to find you're doing more cleaning to keep it looking in tip-top shape, all right? If you have any other questions about cleaning your tables or maintaining them, just give us a call or email, and we would be very happy to help you.